The brother showed up on day 3 with conditions. Not, I'm scared, or I need time to think, or even, what are the risks? Just conditions. I'll give him my liver, he said, standing in the hallway outside the ICU room where his brother was dying. But first, he has to tell the truth. I'd been a transplant ICU nurse for 9 years. I'd seen families fight over who gets to donate. I'd seen siblings compete for the honor of saving each other. I'd seen guilt and obligation and fear. I'd never seen someone hold an organ hostage for a confession. The patient was James, 41 years old, end-stage liver disease from hepatitis C he'd gotten from IV drug use 15 years ago. He'd been sober for 12 years, model recovery, but the damage was done. His MELD score was 38, critically high. He had maybe 2 weeks without a transplant. The brother was Marcus, 38 years old. Perfect match. Type O, compatible antibodies, good health. The transplant team had done all the testing. He was approved. Surgery was scheduled for 6 days out. And then he walked into that hallway and said, "But first, he has to tell the truth." "What truth?" I asked. Marcus looked at me, then at James's door. "Ask him. He knows." I went into James's room. He was awake, jaundiced, ascites making his abdomen distended and painful. He could barely sit up anymore. "Your brother is here," I said. "He says you need to tell him something." James closed his eyes. "He said that?" "He said you know what he means." "I do." He was quiet for a long moment. "Tell him no." "Mr. James, you need this transplant." "I know." "Your brother is a match. He's willing to donate." "With conditions." "Yes." "Then tell him no," James said again. I can't." He stopped. "Tell him to go home." Marcus was sitting in the family waiting area when I came out. "He won't tell you," I said. "Then I won't donate." "Mr. Marcus, your brother is dying." "I know. He has maybe 2 weeks." "I know that too." "Then why?" "Because some things matter more than dying," Marcus said. He stood up. "Tell him he has until surgery day. He confesses, I donate. He stays silent, I walk." He left. I went to my charge nurse. "We have a problem." The transplant coordinator got involved, then the social worker, then the transplant surgeon. Everyone tried talking to Marcus over the next 2 days. His position never changed. "I'll donate, but first he tells the truth." What truth? Nobody knew. Marcus wouldn't say. James wouldn't say. Just 2 brothers locked in some decades-old conflict while one of them slowly died. Day 5, James's ammonia levels were rising, hepatic encephalopathy setting in. He was confused, agitated. The surgeon said they needed to move the transplant up. James was deteriorating faster than expected. Surgery was moved to the next morning, 18 hours away. Marcus came that evening. I was checking James's vitals when he walked in. "Hey, Jimmy," Marcus said quietly. James looked at him. The confusion cleared for a moment. "You came?" "Yeah." Marcus pulled up a chair. "We need to talk." "I know what you want." "Do you?" "Jimmy, please." 23 years, Marcus said. 23 years, Jimmy, and you never said a word. I should have left. This was private. This was family. But something about the way Marcus said it made me stay near the door, pretending to check IV fluids. "I couldn't," James said. "Couldn't or wouldn't. It would destroy her." "It destroyed me," Marcus said, and there was so much pain in his voice. "Do you understand that? What it did to me?" "I know. God, Marcus, I know. But she doesn't. She can't. She deserves to know. She's 70 years old. She's happy. Why ruin that now?" "Because it's the truth," Marcus said. "Because I've carried this alone for 23 years while you played the good son, while you got clean and got your life together and everyone celebrated your recovery. And I can't anymore, Jimmy. I can't keep your secret while watching you get pieces of my body. I realized then what this was. This wasn't about whatever James had done. This was about Marcus carrying the knowledge of it, alone, for more than 2 decades. If I tell her, she'll hate me, James said quietly. Probably. She'll never forgive me. Maybe not. I'd rather die. No, you wouldn't. Because if you'd rather die, you'd refuse the transplant, but you're not refusing. You want to live. You want my liver. You want me to cut myself open and give you part of my body. And I'll do it. But not if it means I'm the only one still carrying your secret. Not if it means I'm enabling you to keep lying to her. James was crying now, silent tears down his yellow-tinged face. What do you want me to say? The truth to Mom before surgery. Marcus, that's the deal. I'm not negotiating. This is cruel. You want to talk about cruel? Marcus's voice rose. You want to talk about cruel, Jimmy? Let's talk about what you did. Let's talk about why I've spent 23 years watching you lie to her face. Let's talk about... Don't, James said. Please, don't say it. Not here. Not with... He looked at me. I should have left. I definitely should have left then. But I didn't. Marcus stood up. You have until morning. Surgery is at 7. Mom will be here at 6. She's coming to see you before you go in. You tell her then. Everything. Or I walk. He left. James looked at me. How much did you hear? Enough to know you're in an impossible situation, I said carefully. It's not impossible. It's very simple. His voice was bitter. I tell the truth and lose my mother. Or I keep lying and lose my life. What did you do? I asked. I shouldn't have asked. But I did. He laughed. A terrible sound. The worst thing. The unforgivable thing. The thing that makes Marcus right to hate me. He doesn't hate you. He's giving you his liver. With conditions. Because he hates what I did. He hates that I made him complicit by telling him. He hates that I've lived with it easily while he's suffered. Have you lived with that easily? No, James said quietly, but easier than Marcus. Because he wanted to tell her. For years he wanted to tell her, and I begged him not to. I made him promise. And he kept that promise because he's a better man than I'll ever be. The night shift came on. I gave report. I should have gone home. I stayed. I found Marcus in the cafeteria at 11 p.m. drinking burned coffee. Can I sit? I asked. He shrugged. This isn't my business, but I've been doing this 9 years. I've seen a lot of family dynamics around transplants. I've never seen anything like this. That's because most families haven't imploded the way ours did. What happened? He looked at me for a long time. If I tell you, you'll understand why I can't let him take my liver without confessing. You'll understand why I've spent 23 years wanting to scream every time my mother talks about what a good son Jimmy is, how proud she is of his recovery, how he turned his life around. Try me. Marcus was quiet. Then, our father died when I was 15 and Jimmy was 18. Car accident. Sudden. Devastating. My mother, she fell apart. Completely fell apart. Couldn't function. My brother and I had to take care of everything. The funeral, the estate, keeping the house running. He paused, drank his coffee. There was life insurance. $500,000. My father had been careful about that. Wanted to make sure we were taken care of. The money went into an account in my mother's name. She was supposed to use it for the house, for our college, for living. I started to see where this was going. Jimmy was 18, legal adult. He was on the account too. My father had added him 6 months before he died, wanted him to be able to help Mom with bills if needed. Smart, responsible Jimmy. Marcus's voice was acid. 6 months after Dad died, Jimmy started using heroin. I didn't know at first. He was good at hiding it, but by the time I was 16, it was obvious. He was stealing, lying, disappearing for days. My mother was so deep in grief, she barely noticed. I noticed. I confronted him. He promised he'd get clean. He didn't, I said quietly. He didn't. Over the next 2 years, Jimmy stole every cent of that life insurance money. $500,000. Gone. Forged my mother's signature, withdrew it in chunks. Some he used for drugs, some he lost to dealers he owed, some just vanished. By the time my mother realized what happened, the account was empty, and Jimmy was gone. Disappeared. Didn't come back for 3 years. Oh, God. My mother couldn't pay the mortgage. We lost the house. Lost everything. She had to move into a shitty apartment, work 2 jobs. I couldn't go to college. There was no money. The money my father died to provide for us, the security he tried to build, Jimmy stole it all and shot it into his veins. And your mother doesn't know. My mother thinks the money was lost to bad investments. Jimmy came back after 3 years, sober, apologetic, told her she'd been lost in grief and addiction, but never mentioned the money. I knew the truth. I'd found bank records, seen the forged signatures. I confronted him. He broke down, begged me not to tell her, said it would destroy her to know what he'd done, said she'd already lost Dad, lost the house, lost 3 years with him. She couldn't lose the memory of who her son had been. So you agreed. I was 19 years old and exhausted. I agreed because I thought telling her would hurt her more. I agreed because Jimmy seemed genuinely remorseful. I agreed because I was stupid and thought keeping the secret would be easier than dealing with the truth. But it wasn't. It wasn't because Jimmy got clean. Really clean. 12-step programs, therapy, the whole thing. He rebuilt his life, got a job, got married, became the son my mother had always wanted. And she loves him. She's so proud of him. She tells everyone about his recovery, his strength, his redemption. And you're the only one who knows? I'm the only one who knows that her house and her future and my college fund went into Jimmy's arm. I'm the one who knows that the medical expenses from Dad's accident that she thinks drained the account was actually her son forging her name. I'm the only one who remembers watching her cry over bills while Jimmy was unconscious in some shooting gallery with our inheritance.
He was crying now, quiet tears. So yeah, he said, I'll give him my liver. I'll cut myself open and give him a piece of my body. But not while I'm the only one carrying this. Not while she still thinks he's her redemption story. Not while I'm protecting his comfortable recovery at the cost of the truth. I didn't know what to say. Is that cruel? Marcus asked. To make him confess as a condition of donation? I don't know, I said honestly. Maybe, but I understand why. He'll tell her, Marcus said. He wants to live too badly to refuse. He'll break her heart to save his life. And maybe that makes me a monster for forcing it, but I can't be the only one hurting anymore. I went back upstairs. James was awake, staring at the ceiling. She'll be here at 6, he said when I walked in. Not a question. Yes. And Marcus will be here too, to make sure I do it? I imagine so. I stole $500,000 from my mother, James said to the ceiling. Money my dead father left to take care of her. I forged her signature, and I stole it, and I used it to get high while she lost her house and worked herself half to death. And tomorrow I'm going to tell her that, right before I go into surgery. So the last thing she knows before they cut me open is that her son is the thief who destroyed her life. She'll also know you're getting a second chance, I said quietly. She won't care. She won't forgive me. Would you? I don't know. I wouldn't, he said. If I were her, I wouldn't forgive me either. Then why did you do it? I was 20 years old and addicted to heroin. I wasn't thinking about consequences. I wasn't thinking about her. I was thinking about not being sick, about getting through the next few hours. That's how addiction works. You sacrifice everything for right now. And after, when you got clean, After, I was too ashamed to tell her, too scared. I kept thinking I'd find a way to pay her back, make it right somehow. But I never did. The debt just got bigger and the years just kept passing, and it became easier to pretend it never happened. Marcus couldn't pretend. No, Marcus couldn't pretend, because Marcus is good, better than me. He always has been, and I made him an accomplice to my lie. 6 a.m. came too fast. Their mother arrived at 5:47. Small woman, gray hair, kind eyes. She hugged James carefully, mindful of his condition. "Oh, honey, today's the day. You're going to be okay. Marcus is so brave to do this." Marcus was standing in the doorway. "Mom, Jimmy has something to tell you." She looked confused. "Now? Right before surgery?" "It can't wait," Marcus said. James looked at his brother, then at his mother, then at me. "Mrs. Chen, maybe we should give you some privacy?" "No," James said. "Stay. Someone should witness this." I stayed. "Mom," James said, and his voice was shaking, "the life insurance money. After Dad died, the $500,000? Oh, honey, don't worry about that now. I know, it was hard to lose." "I stole it." He said it flat, clean. "I stole all of it, every cent. The bad investments, the medical expenses, that was a lie. It was me. I forged your signature. I took the money. I used it for heroin." The room went silent. "What?" His mother's voice was barely a whisper. "The house, your jobs, everything you lost, that was me. I stole Dad's life insurance and I destroyed our family with it. And I've lied about it for 23 years. I watched her face, watched confusion become comprehension, become devastation. She couldn't finish. She looked at Marcus. "You knew?" "He told me when he came back," Marcus said quietly. "I wanted to tell you. He begged me not to. I've been carrying it ever since." She looked between her sons, the one dying in the bed, the one standing whole and healthy, about to give up a piece of himself. "You stole my husband's life insurance. You stole my house. You let me work 2 jobs. You let me believe—" She stopped. "And you?" She looked at Marcus. "You knew and never told me?" "I'm sorry," Marcus said quietly. "I thought I was protecting you." "Protecting me? By lying? By letting me think—" She was crying now. "I've spent 23 years being proud of you, telling everyone about your recovery, about how strong you were, and all of it was built on theft and lies?" "Mom," James started. "Don't," she said. "Don't call me that right now." The transport team arrived. "We need to take Mr. Chen to pre-op," the tech said. Their mother looked at James, at Marcus, at the life support equipment keeping her eldest son alive. "Do the surgery," she said. Her voice was cold. "Save his life. And then I never want to see either of you again." She walked out.
The surgery took 9 hours. I wasn't in the OR, but I followed the updates. Clean removal from Marcus, successful implantation in James. Both patients stable. I checked on them in recovery. Marcus was awake, groggy, hand on his abdomen where they'd taken a portion of his liver. "She left," he said when he saw me. "Mom left. She's not answering my calls." "She's in shock," I said. "She hates us both now. Him for lying, me for enabling it. I thought the truth would fix things, but it just broke everything else." James was still sedated, wouldn't wake for hours. When he did, he'd have a new liver and no mother. I saw Marcus in the hallway 3 days later. He was being discharged, moving carefully, painful, but healing. "Have you heard from her?" I asked. "No, Jimmy neither, as far as I know. He asked me yesterday if I thought she'd ever forgive us." "What did you say?" "I said I didn't know, but that at least now she knows the truth. At least we're not lying anymore." "Was it worth it?" I asked. The confession, the condition. Marcus was quiet for a long time. I gave my brother a piece of my liver, literally cut myself open and gave him part of my body. And he's going to live. He's going to get years he wouldn't have had. That's worth something. But your mother? My mother lived 23 years believing a lie. A comfortable lie, but a lie. Now she knows the truth. Maybe she'll forgive us eventually, maybe she won't. But at least she knows who her sons actually are. And if she never forgives you, then I'll live with that. I've been living with worse for 23 years. He left. James stayed another week. His new liver functioned perfectly, no rejection, good recovery. The transplant team called it a success. I checked on him the day before discharge. He was sitting up, eating real food, color returning to his face. She's not coming. My wife keeps calling her. She won't answer, won't return messages. I'm being discharged tomorrow, and my mother won't... He stopped. I'm alive because Marcus gave me his liver, and I don't think she'll ever forgive either of us. Do you regret telling her? I asked. I regret what I did. I've regretted it for 23 years. Telling her... He paused. Marcus was right. She deserved to know. But God, the look on her face. I keep seeing it. The way everything she thought about me just broke. You broke it 23 years ago, I said quietly. She's just finding out now. I know. But there's a difference between what I did and her knowing what I did. When it was secret, she still had a son. Now she has what? A thief? A liar? Someone she doesn't recognize? Someone who's alive because your brother loved you enough to cut himself open, even after everything. James looked at his hands, at the IV site that was healing, at the body that was living because of his brother's sacrifice. I don't know if that makes it better or worse. I didn't have an answer. 3 months later, I saw a note in James's outpatient chart. His mother had attended his follow-up appointment, sat in the waiting room, didn't speak to him, but she came. 6 months later, another note, mother present at appointment. Brief conversation reported by patient. A year later, family dinner attended. Relationship slowly rebuilding per patient report. I don't know if she ever fully forgave them. I don't know if you can fully forgive that kind of betrayal, the theft, the lies, the decades of carrying on as if none of it had happened. But I think about Marcus sometimes, about how he loved his brother enough to save his life even while hating what he'd done, about how he couldn't give that gift while still carrying the secret alone. I think about what he said. Some things matter more than dying. For Marcus, the truth mattered more than letting his brother die. But it also mattered more than his relationship with his mother, more than 23 years of peace, more than the comfortable lie everyone was living. I still don't know if that was right. I don't know if forcing a deathbed confession as a condition of donation was ethical. I don't know if Marcus saved his brother or punished him. I don't know if the truth was worth the cost. But I know this. James is alive. Marcus gave him that. At the cost of their mother's innocence and maybe their family's future. And sometimes in the ICU, there are no good choices. Just choices that keep people alive and the things we demand from each other before we're willing to save them.
The first time he threatened to sue me, I was drawing blood from his mother's central line. If you let her die, he said, standing so close I could smell his coffee breath, I will sue you personally. I will sue this hospital. I will sue everyone who touches her. Do you understand me? I understood him. I'd understood him since he arrived 6 hours after his mother coded, 3 states away when she stopped breathing, armed with the lawyer's number already programmed into his phone. His mother's DNR order was paper-clipped to the front of her chart, signed by her, dated 4 months ago, notarized. Her signature shaky but legible. Margaret Chen, do not resuscitate. We'd resuscitated her anyway, because her son said to. I've been an ICU nurse for 14 years. I've seen families struggle with end-of-life decisions more times than I can count. I've held hands through withdrawal of life support. I've watched people say goodbye. I've seen grief do terrible things to rational people. But I'd never seen someone fight against their parents' explicit written wishes until I met David Chen. His mother came in on a Thursday night. 83 years old, end-stage COPD, third admission in 2 months. She'd been declining for years, slowly, then rapidly. Hospice had been recommended. She declined hospice, but signed a DNR. I don't want machines, she told her pulmonologist. When it's time, it's time. It was time on Thursday at 11:47 p.m. Her oxygen saturation dropped. She stopped breathing. The night nurse found the DNR order and called it. Time of death, 11:51 p.m. Then, David showed up. He arrived at 6 a.m. Friday morning, walked past the nurse's station, into her mother's room where her body was being prepared for the morgue, and started screaming. "What did you do? What the fuck did you do to my mother?" The night nurse tried to explain. The DNR order, the respiratory failure, the peaceful passing. "I didn't authorize that," he said. "I'm her power of attorney. You can't just let her die." "Sir, she had a DNR. I don't care what she signed. I'm her son. I'm her decision maker. You should have called me." They did call him 3 times during her decline. He didn't answer. He was in a work meeting, he said later, an important meeting. He'd planned to call back. But here's what made everything complicated. He was her power of attorney for financial decisions. The medical power of attorney spot on her form was blank. She'd never designated anyone. So technically, as next of kin, David had legal standing. And he wanted her back. "You need to resuscitate her," he told the attending who'd been called in for the crisis. "Now, immediately." "Mr. Chen, your mother has been deceased for 6 hours. I don't accept that. She wouldn't want this. She'd want to fight." The attending, bless him, tried. "Your mother signed a DNR order 4 months ago. She made her wishes very clear. She was depressed when she signed that. She didn't mean it. She'd want every measure taken." "Sir, when someone signs a DNR, are you refusing to treat my mother because of her age? Because I will have your medical license. I will call the state board. I will call every news station in this city and tell them you're running a death panel in this ICU." That was Friday morning. By Friday afternoon, we had a legal crisis. David had called a lawyer. The lawyer called the hospital legal team called the medical team, and somehow, the decision was made to readmit Margaret Chen's body to the ICU and attempt resuscitation. I was off Friday. I came back Saturday and she was in room 7, intubated, on pressors, post-cardiac arrest protocol in a patient who'd been dead for 8 hours before they shocked her heart back into a rhythm. "What the fuck?" I said to my charge nurse. "Legal told us to do it," she said. She looked exhausted. The son was threatening litigation, something about age discrimination and failure to provide appropriate care. They're calling it a witnessed arrest with delayed response. She had a DNR. I know. She'd been dead for 6 hours. I know. This is insane. I know. But Margaret Chen was back. Sort of. Her heart was beating because we were forcing it to beat. Her lungs were working because we were breathing for her. Her brain? Her brain was gone. You don't come back from 8 hours of no circulation. You just don't. David visited every day. He brought music, Frank Sinatra, her favorite. He brought her favorite lotion and rubbed it on her hands. He read to her from the newspaper. He talked to her like she could hear him. "The doctors say you're improving," he'd say, holding her limp hand. "You're a fighter, Mom. You've always been a fighter." She wasn't improving. Her kidneys were failing. Her liver enzymes were rising. Her brain showed no meaningful activity on EEG. Every specialist who evaluated her said the same thing. There was no person left in there. We were circulating blood through a body whose brain had been oxygen deprived for too long. I tried talking to him once, day 4. I'd been assigned to his mother's care. "Mr. Chen," I said carefully, "I need to talk to you about your mother's condition." "She's stable," he said immediately. "The doctor said she's stable." "She's stable because of maximum life support. But her brain activity, she squeezed my hand yesterday." That was likely a reflex. When someone has the kind of brain injury your mother has, you don't know that. You don't know what she can recover from. My uncle was in a coma for 3 weeks and he woke up fine. Your mother was without oxygen for... Are you saying you want to give up on her? I'm saying your mother signed a DNR because she didn't want this. His face changed. You don't know what my mother wanted. You didn't know her. I'm her son. I know what she'd want. She wrote it down, I said quietly. 4 months ago, she told her doctor. She was depressed when she signed that. She didn't mean it. She'd want every measure taken. She signed a legal document. I'm signing legal documents now. I'm her power of attorney, and I'm saying full treatment. Everything. If her heart stops, you restart it. If she stops breathing, you keep her on the ventilator. If anything happens, you save her, because that's what a good son does.
He looked at me with such righteous certainty that I felt sick. "Mr. Chen," I said, "with respect, your mother didn't want machines keeping her alive. She made that choice when she was healthy enough to make it. We're not honoring her wishes." "Her wishes?" He laughed, bitter. "Her wishes were written when she was giving up. I'm not giving up. I'm fighting for her. Why aren't you?" "Because she's not here anymore," I said, and I shouldn't have said it, but I was so tired. "I'm sorry, but your mother is gone. We're keeping her body alive, but she's..." He stood up so fast his chair fell over. "Get out. Get out of this room right now." "Mr. Chen, you want her dead. You probably want this bed for someone younger, someone more profitable, but I won't let you kill my mother to free up space. I know how this works. I've read about this. Hospitals push old people toward death because it's cheaper. Well, not my mother, not on my watch." He filed a complaint, claimed I'd tried to convince him to withdraw life support for financial reasons. My manager had to write me up formal documentation of the complaint, even though she told me privately I'd done nothing wrong. "He's grieving." I said, "He's torturing her. She's not suffering. She's not conscious. She didn't want this. It's in writing. Why doesn't that matter?" My manager looked at me for a long moment. "Because the law says family can override a DNR if they push hard enough and threaten loud enough. Because our legal team is terrified of litigation. Because he's her son, and we're just the nurses." Week 2, Margaret developed pneumonia, sepsis, multi-organ failure. We poured antibiotics into her, added medications to support her blood pressure, started dialysis for her failed kidneys. David approved everything. "Whatever she needs," he said. "Cost is not an issue." The ethics committee met. They agreed the situation was untenable, but said their hands were tied. David had legal standing, Margaret hadn't specified anyone else as decision-maker, and the DNR could theoretically be argued as outdated, given it was signed months before this acute event. "But she signed it," I said at the meeting. "She knew she was dying. She made an informed choice." "And her son is making a different choice," the ethics consultant said, "as is his legal right. Even though it violates what she wanted?" "Her documented wishes aren't being honored," the consultant admitted, "but we can't force a family member to accept death. Legally, we're in difficult territory." Week 3, I was changing her dressings. She had breakdown injuries from immobility despite our best efforts. And David walked in. "How is she today?" he asked. I looked at him, really looked at him. He'd lost weight, had dark circles under his eyes, his shirt was wrinkled. He looked like he wasn't sleeping. I said, "She's declining, honestly."
The sepsis is getting worse despite maximum antibiotics. Her heart rhythm is becoming unstable. Her kidneys haven't produced urine in 4 days. But she's still fighting. Mr. Chen, she's not fighting. She's not doing anything. We're doing everything. The machines are doing everything. Because that's what she needs right now. Is it? I asked quietly. Or is it what you need? He stared at me. I'm sorry, I said. I shouldn't. You think I'm doing this for me? His voice cracked. You think I want to watch my mother like this? You think I want to see her hooked up to machines, unresponsive, declining every day? Then why? Because I wasn't there. He said it so quietly I almost didn't hear. When she stopped breathing, when she died, I wasn't there. I was in a fucking meeting. She was dying and I was in a conference room talking about quarterly projections. They called me 3 times and I didn't answer because I thought I'd call her back. I thought I had time. He sat down hard, still looking at his mother. And then she died. She died alone. No one holding her hand. No one telling her it was okay. She died in a hospital room by herself while I was 3 states away worrying about profit margins. Mr. Chen. So yes, I'm keeping her alive because I wasn't there when she needed me. Because I can't just let her go like that. Not alone. Not without me there. Not without her knowing I'm sorry. I understood then. This wasn't about his mother. This had never been about his mother. This was about him. She's already gone, I said gently. What we're doing now, it's not for her. She's not here to know you're sorry. She's not here to forgive you. She's not here at all. You don't know that. I do know that. I've been doing this 14 years. I know what brain death looks like. I know what absence looks like. Your mother left 3 weeks ago. What we're keeping alive, it's not her anymore. Then what's the harm in trying? He asked, and he was crying now. What's the harm in giving her more time, in giving me more time? The harm, I said carefully, is that it's not what she wanted. She made that clear. She signed a DNR because she didn't want to exist like this, and we're forcing it on her. We're doing to her exactly what she was afraid of. He wiped his face. The DNR doesn't matter anymore. She's already been resuscitated. We've already crossed that line. So now we finish what we started. Or we stop. We honor her original wishes. We let her go peacefully. We tell her you're sorry and you love her and it's okay to go. Because that's what she wanted. That's what she wrote down that she wanted. I'm not ready, he whispered. I know, but she was ready. 4 months ago. She was ready. He looked at his mother for a long time. At the ventilator breathing for her. At the machines beeping. At the medications dripping into her veins. At her hands. No longer the hands that had held him as a child. Swollen, mottled, cool to touch. She'll hate me, he said, for this, for all of it. She'll forgive you, I said. I didn't know if that was true, but I said it anyway. I need to think, he said. He left. He came back the next day with papers, withdrawal of life support authorization, signed. I want to be there, he said. When you stop everything, I want to hold her hand. Of course. And I want you to tell her I'm sorry, even if she can't hear. I want someone to say it out loud. We withdrew support that evening. David held his mother's hand. I told her he was sorry, that he loved her, that it was okay to go. Her heart stopped 14 minutes later. David sat with her for 2 hours. Just sat there, holding her hand. When he finally left, he stopped at the nurse's station. I shouldn't have threatened you, any of you. I shouldn't have. He couldn't finish. You were grieving, I said. I was selfish, he corrected. I kept her alive because I needed to feel like I'd done something, like I hadn't failed her. But I did fail her. I failed her the moment I ignored her DNR. I didn't argue. He left. I wrote my final note in Margaret Chen's chart. Noted the withdrawal of life support, the family at bedside, the peaceful passing. I didn't note that we'd kept her alive for 3 weeks against her explicit documented wishes. I didn't note that her son's guilt had been more important than her autonomy. I didn't note that we'd done everything she'd specifically said she didn't want. That's not the kind of thing that goes in charts. That's the kind of thing that stays with you. I think about Margaret Chen a lot. About her DNR order that didn't matter. About how clear she'd been about her wishes and how easily we ignored them. About how a son's grief and guilt became more legally powerful than a mother's written directive. I think about David too. About whether he ever forgave himself. About whether he understands that keeping her alive didn't erase his absence when she first died. It just prolonged it. Mostly, I think about how we treat DNR orders like they matter until someone with legal standing says they don't. Then they're just paper, suggestions, old wishes that families can override because they're in pain and we're afraid of lawyers. Margaret Chen wrote down what she wanted. She signed it. She made it legal. And we ignored it. Because her son said to. I don't know what the answer is. I don't know how to honor patient autonomy when families disagree. I don't know how to force someone to accept that their parent is gone when they're not ready. But I know Margaret Chen didn't want machines breathing for her. And we made her exist that way anyway, for 3 weeks, because we were more afraid of her son than we were of violating her wishes. I still have patience with DNR orders. I still advocate for them. But I've learned something in the 14 years I've been doing this. DNR orders matter right up until someone with legal standing says they don't. And then they're just paper. Just paper a dying woman signed, hoping it would matter when the time came. It didn't.
I've been an ICU nurse for 11 years. I've seen families fight over everything. Ventilator decisions, DNR orders, who gets to stay past visiting hours. I've seen adult children who haven't spoken in decades suddenly show up when their parent is dying. I've mediated more screaming matches than I can count. But I'd never seen 2 women both claim to be the same man's wife until Michael came in. Michael arrived on a Tuesday morning post-cardiac arrest. 47 years old, found unresponsive at his office. We got him back, but he never woke up. Anoxic brain injury. The attending gave him maybe a 15% chance of meaningful recovery, and that was generous. The first wife showed up within an hour. I'll call her Patricia. Early 40s, well-dressed, that pulled-together look that comes from having money and knowing how to spend it. She had paperwork, marriage certificate, power of attorney, health insurance cards with her name on them, everything legal and laminated and organized in the leather folder. I'm his wife, she said. Very calm, very controlled. I need to know everything. I gave her the update. Critical condition, induced coma, too early to know outcomes. She nodded at all the right times, asked appropriate questions about brain activity and Glasgow Coma Scale scores. Then she said, I want to be the decision maker. I have medical power of attorney. She did. I verified it. Dated 8 months ago, notarized, completely legal. The second wife showed up 3 hours later. I'll call her Lisa. Late 30s, wearing scrubs from a dental office, no makeup, looked like she'd been crying the whole drive. She ran past the nurse's station straight to Michael's room before anyone could stop her.
When I followed her in, she was holding his hand and sobbing, saying, "Baby, please, please wake up, please." "Ma'am," I said gently, "I need to ask, what's your relationship to the patient?" She looked at me like I'd asked what color the sky was. "I'm his wife." I felt my stomach drop. His wife already checked in," I said carefully. "Patricia." Lisa's face changed. Everything hardened. "Patricia," she said, and it sounded like a curse. "That bitch is here?" I'm used to family drama, but the way she said it made my skin crawl. "Ma'am, I need to see some identification and..." She pulled out her phone, showed me her lock screen, photo of her and Michael, kissing, recent. Then her wallet, license with her last name as his, joint bank account statements, a marriage certificate on her phone dated 4 years ago. 4 years ago. Patricia's was dated 6 years ago. I excused myself and went straight to my charge nurse. "We have a problem." That's when it started. Patricia arrived the next morning with her lawyer. They set up in the family conference room like it was a boardroom. She had documents, mortgage papers, tax returns, photos spanning a decade. She said, "I am Michael's legal wife. We own a home together. We file taxes jointly. I have medical power of attorney. That woman has no legal right to be here." Lisa showed up 20 minutes later. No lawyer, just rage. "Legal wife?" she screamed in the hallway. "I'm his wife. I live with him. I sleep next to him every night. I know his pharmacy, his allergies, his doctors. Ask me anything about him, anything, and I'll know. Ask her his mother's name. Ask her what medication he takes for his back. Ask her what side of the bed he sleeps on." My charge nurse tried to calm her down. "Ma'am, if you could just..." "Ask her," Lisa said, pointing at Patricia through the conference room window. "Ask her when he had his appendix out. Ask her what he drinks in his coffee. Ask her what makes him laugh." I knew where this was going. I'd seen it before, different context, same dynamic. The legal spouse versus the actual spouse. But usually one of them knows they're the secret. "Did you know about Patricia?" I asked Lisa quietly. She looked at me. "Of course I knew about Patricia. She's his ex-wife. They divorced 2 years ago." My charge nurse and I looked at each other. "Ma'am," my charge nurse said slowly, "Patricia has current legal documents, marriage certificate, power of attorney, dated 8 months ago. There's no divorce filing in our system verification." Lisa's face went white. That's impossible. He divorced her. He told me, "We got married 3.5 years ago. I have this certificate. It's legal. I was at the courthouse." So was Patricia. 6 years ago. It took Lisa 10 seconds to understand. When she did, I watched something break in her face. He didn't. He wouldn't. But he did.
Michael was a bigamist. 2 wives, 2 homes, 2 complete lives. Patricia in the suburbs with the big house and the country club membership, Lisa in an apartment downtown near her dental office. He'd told Patricia he traveled for work, consulting, 3 weeks a month. He'd told Lisa he was divorced and his ex was difficult, which is why he needed to keep some assets separate. He'd been running both lives for 4 years. And now he was unconscious, possibly dying, and both wives were standing in my ICU expecting to make his medical decisions. The hospital legal team got involved, social work got involved. Hospital security had to keep the 2 women separated because the screaming matches were disturbing other patients. Patricia stayed cold and clinical. I have legal standing. Lisa stayed emotional. I'm his actual wife. I'm the one who knows him. But here's the thing that made it unbearable. They were both right. Patricia had the legal authority. The power of attorney was ironclad. Her marriage was never dissolved. In the eyes of the law, Lisa's marriage didn't exist. Bigamy voids the second marriage automatically in most states. Patricia could make all the decisions. But Lisa knew him.
On day 4, the neurologist said Michael's brain activity was minimal, suggested family consider comfort measures. Patricia scheduled a meeting. Her lawyer, the medical team. Lisa wasn't invited. I was assigned to Michael that day. Lisa showed up during the meeting, figured out what was happening, and tried to force her way in. Security had to escort her out. She stood in the hallway crying, and I could hear Patricia through the door, calm and measured. I think we should begin discussing withdrawal of life support. I don't know what made me do it. I wasn't supposed to, but I went to Lisa in the hallway. His medication, I said quietly. For his back. What is it? She looked at me, confused. Cyclobenzaprine, 10 milligrams at night. Why? I went back to my station. Checked his home medication list that Patricia had provided during admission. She'd listed Tylenol. His coffee, I said when Patricia came out. Black. Why does this matter? I asked Lisa later. Cream and 2 sugars. The real stuff, not the packets. He says the packets taste like chemicals. I checked everything. His mother's name, Patricia didn't know. Lisa knew immediately. His appendix scar, Patricia didn't know he had one. Lisa mentioned he was self-cautious about it. His sister's birthday, Patricia said April, Lisa said June. I checked his phone contacts when the police brought his belongings. His sister's birthday is June 14th. Patricia had documents. Lisa had him. But documents win. They always win. That's how the system works. The meeting was scheduled on day 7, withdrawal of life support. Patricia's decision as the legal spouse with power of attorney. The medical team agreed. Poor prognosis, minimal brain activity, no meaningful recovery expected. Lisa wasn't allowed in the room. I was hooking up Michael's IV medications when Patricia came in at 6 a.m., 2 hours before the meeting. She stood at the foot of his bed for a long time, not saying anything. Did you know? I asked. I shouldn't have asked. It wasn't professional. But I needed to know. She looked at me. About her? Yes. I knew he was having an affair. I didn't know he had married her. I thought, when he came home, he was distant, different. I thought it was stress or a midlife crisis or just how marriages change. She paused. I loved him for 20 years. Does it matter that I didn't know his coffee order? I didn't answer. She loved him for 4 years, 4 years of lies. I had 16 honest years before the lying started. Doesn't that count for something? I don't know, I said honestly. The power of attorney gives me the right to decide, she said. That's what the lawyers say. That's what the hospital says. So I'm deciding. The family meeting started at 8. Patricia, her lawyer, the attending, the neurologist, social work, my charge nurse. I wasn't supposed to be there, but they needed bedside staff for clinical context. Patricia sat very straight. She said, I've thought about what Michael would want, and I think... She stopped. Started again. The prognosis is poor. The doctors agree. Continuing aggressive treatment would be prolonging suffering. The attending nodded. We can make him comfortable, discontinue the ventilator. He'll pass peacefully within minutes to hours. However, Patricia said, and everyone looked up, I've been thinking about what he would want, not what I want. And the truth is, I don't know anymore. I thought I knew him. I thought I knew him better than anyone. But I didn't know he had another wife. I didn't know he took medication for back pain. I didn't know he drank cream in his coffee. She looked at me, then at her lawyer. There's someone who does know those things. My charge nurse started to interrupt. Mrs. I'm the legal wife, Patricia said. I have decision-making authority, and I'm authorizing Lisa to make the medical decisions. Her lawyer looked like he'd been electrocuted. You can't, that's not, she has no legal standing. I'm declining to make the decision, Patricia said. I'm saying I don't have the information necessary to represent what Michael would want. Lisa does. That's not how power of attorney works, the lawyer said. Then I'm revoking my participation, Patricia said. I'm saying I don't know him well enough to decide. There was chaos. Legal discussions, arguments about authority and precedent and liability. But Patricia was immovable. She said, I won't sign the withdrawal authorization. Find another way. They did, eventually. Lisa was allowed into the meeting. She sat across from Patricia, the two of them separated by 6 feet in the wreckage of a shared husband. He'd want to fight, Lisa said. Her voice was shaking but certain. He's terrified of dying, has nightmares about it. He'd want us to wait, to give him time to try everything.
The neurologist explained, again, the minimal brain activity, the poor prognosis. But it's not 0, Lisa said. You said 15% chance. That's not 0. It's unlikely. It's not 0, she repeated. He'd want to try. Patricia didn't say anything. She just signed a form removing herself from medical decision-making and walked out. Lisa stayed. Michael stayed on the ventilator. 1 week became 2. 2 became 3. His brain activity didn't improve. Lisa came every day. Patricia never came back. On day 23, I was checking his pupils, routine neuro exam, and he squeezed my hand. Purposeful movement, first sign of meaningful recovery. He woke up 6 days later, confused, weak, significant cognitive deficits, but alive, responsive. He knew his name. Eventually, he knew what happened. I wasn't there when they told him about Patricia and Lisa both showing up. I heard he cried. I heard he tried to explain and couldn't. I heard Patricia filed for divorce immediately, and Lisa, I don't know what Lisa did. She stopped coming to the ICU once he transferred to rehab. I saw Michael's discharge summary 3 months later. Outpatient rehab, living alone, significant support needs. Both women declined to be listed as emergency contacts. I think about Patricia sometimes, about how she knew the marriage was failing but stayed anyway, about how she had every legal right to end his life support and chose not to, about how loving someone for 20 years means something, even when the last 4 were built on lies. I think about Lisa more, about how she knew him better than anyone, and it didn't matter legally, about how she fought for him when his legal wife was ready to let him go, about how she saved him and then lost him anyway. Mostly, I think about power of attorney documents, about how we treat them as absolute truth, about how the law says one kind of knowing matters, the documented kind, the notarized kind, the kind that holds up in court. But there's another kind of knowing, the kind that remembers cream and 2 sugars, the kind that knows about appendix scars and nightmare fears and medication lists. I've been doing this 11 years. I've verified thousands of power of attorney forms. I've never questioned one before. I've never thought about what we're really asking when we ask, who has the legal right to decide? Maybe we're asking the wrong question. Maybe we should ask, who actually knows this person? But we don't. We ask for documentation. And most of the time, nobody fights back. Patricia fought by not fighting. She had the power and she gave it away because she knew she didn't have the knowledge. That's the thing that keeps me up at night. Not the bigamy, not the medical drama, but the fact that Patricia knew she didn't know him anymore. And she cared more about what he would want than about her legal right to decide. I've seen families fight to the death over life support decisions. Siblings who barely speak demanding authority. Children who haven't visited in years suddenly claiming they know what's best. I'd never seen someone with authority choose to give it up. Michael lived. Both marriages ended. I don't know if he's grateful for the second chance or if he wishes Patricia had just signed the form. I check power of attorney documents more carefully now. I ask more questions. Not just who has legal authority, but who was with them last? Who knows their current wishes? Who sees them daily? The legal team hates me for it. But I can't forget Lisa standing in that hallway, crying, knowing exactly what medication he took and what he drank in his coffee and what he feared most, and having none of it matter. I can't forget that we almost killed him based on the judgment of someone who didn't know him anymore. And I can't forget that the only reason he's alive is because his legal wife loved him enough to admit she wasn't his real wife anymore. I don't know what that makes Patricia, but I think about her more than I should.